Hey everybody, I'm Dr. Perkins, a board-certified OBGYN, and today we're talking about can PCOS cause an ectopic pregnancy? I'm glad you're here with us today, and this is such an important topic because ectopic pregnancies are emergencies, and PCOS is a condition that can really alter the way that your life and your body feels. And so today we're merging them together and talking about this. We'll talk about what exactly is an ectopic pregnancy, how PCOS affects pregnancy, and how to reduce risk factors for developing an ectopic pregnancy, especially when you have PCOS. So let's talk about ectopic pregnancies. Ectopic pregnancies are pregnancies that occur outside of the uterus. And that means outside of the system where pregnancies should develop. Now, in general, before a pregnancy gets established, it starts in the fallopian tubes. And we want this to happen. And so egg and sperm will meet in the fallopian tube and travel together as they multiply and reproduce and just grow into this beautiful baby. But this should not happen beyond the first couple of days after fertilization happens. Within the first week, we expect that pregnancy to be inside of the uterus, establishing itself and growing right exactly where it's supposed to. The uterus in general is supported by muscles and fluid and blood and everything that the pregnancy needs, and so we want the pregnancy to be there. When the pregnancy happens somewhere else, which can be in so many different places, such as it starts in the fallopian tubes but remains in the fallopian tubes. This is the most common ectopic pregnancy that exists. But this pregnancy can also be on your ovary, it could be by your bladder, it could be by your bowels. Pregnancies have been in strange places. Anything outside of the uterus is an ectopic pregnancy. Now, PCOS is a hormonal disorder that can impact the way that your reproductive system works and the structures of that system. So, for instance, your fallopian tubes. PCOS does and can affect the fallopian tubes. It can affect how it functions. It can affect the tiny little hairs that are located within the tubes. They're really super important to help to move that pregnancy along. PCOS overall, systemically, can cause you to have an insulin-resistant state, which means that your body is not responding and your cells are not responding to the insulin that your pancreas produces. Therefore, your pancreas tries to produce so much more insulin to help to balance all the carbohydrates and the sugars that you're eating, and essentially the system fails over time. Thirdly, PCOS may cause your body to be in a low chronic state of inflammation. In general, inflammation isn't good. We want our bodies to be balanced and to be well, and being inflamed is not a state of well-being. So now, while PCOS in and of itself is not directly linked with ectopic pregnancies, we know there's a relationship between the two, and it can indirectly affect the way your body works. It may also do the following. PCOS often will cause you to have irregular periods and irregular ovulation. That makes it very difficult for you to track whether or not you're ovulating, the site of which you're ovulating, or to plan for pregnancy when you actually want it to be. If you are having an ectopic pregnancy, sometimes there could be a delay in that diagnosis because your system is so unpredictable. As mentioned earlier, PCOS may affect the way that your fallopian tubes work. So this may hinder your ability to move that pregnancy along, therefore increasing the likelihood of getting an ectopic pregnancy. PCOS may also affect the way that your uterus works. After conception, pregnancies move along the fallopian tubes and establish themselves inside of the uterus. If you do have problems with your uterus and the lining, you are potentially at risk of losing the pregnancy because your uterus is not in a state to support a growing pregnancy. According to the American College of Obstetricians and Gynecologists, While ectopic pregnancies occur in 1 to 2% of all pregnancies, there is no strong evidence directly linking PCOS to a higher incidence of ectopic pregnancies. We know that there's no direct link between ectopic pregnancies and PCOS, but we do know that indirectly PCOS can affect the way our organs, fallopian tubes, and the uterus in particular, and the ovaries really, and how they work. It is important that if you do have PCOS, that we support your body well. There are ways that you can reduce your risk of getting an ectopic pregnancy when you are with PCOS. The first is to be monitored. Know your system well. It means keeping track of your periods and your ovulations as best as you can. With that, if you are pregnant, you're able to detect if the pregnancy is developing in the right location much earlier than if you are not sure if you're pregnant. And so knowing your cycles, knowing when you ovulate, and knowing when you get pregnant earlier is always best. Manage hormonal imbalances. I know this is easier said than done. It is a challenge when you have PCOS to balance your hormones. And so it's important that you try, because I've had so many patients and so many people who have followed some of the recommendations that I make for creating hormonal balance, and it has worked to get you to that place where you will balance your hormones, you will balance your body, and you'll create a state that is best for a developing pregnancy. It's important that you also balance your carbohydrate and glucose levels. In general, with PCOS or insulin resistance, you may have higher carbohydrates and glucose load in your system than you ought to. And with that, it may be more challenging for you to lose weight, to create balance, to get pregnant, and maintain a pregnancy as well. So now I want you to be empowered to be able to manage PCOS and your symptoms and be aware of ectopic pregnancies and what that may mean for you. If you are certain that you are pregnant, it's important that we know your hormone levels, which means that I'd like for you to go to the doctors and for them to check to see what your human chorionic gonadotropin or your HCG hormone levels are. It's also important that you get an early pregnancy ultrasound. The reason for this is that an ultrasound will detect exactly where that pregnancy is growing. If that pregnancy is in your uterus, wonderful, it's where it's supposed to be. If that pregnancy is outside of the uterus, then we can begin the process of treatment, which may come in multiple different forms, but it's important that you start that treatment earlier than later if you do have an ectopic pregnancy. If you are in this journey trying to create that balance and trying to reduce the risk of you getting an ectopic pregnancy, and you'd like a little bit of assistance with that, I have a free gift for you. That gift is a free quiz that is only going to take a few minutes of your time, but it will evaluate your lifestyle and check to see if you are doing anything outside of the norm that could be harming and hurting your hormones. And so if you'd like to do this quiz, go ahead and click that link down below in the description. And if you'd like to just immerse yourself in this conversation a little bit further and talk about ectopic pregnancies and PCOS, go ahead, leave a comment below, and let's support each other in this journey. And if you have a question, I'll be more than happy to answer that. Thank you so much for being here today. I'm Dr. Perkins, a board certified OBGYN, and I hope to see you again on the next video. Thanks for being here.